Hi Lifesavers, I'm Roz. I'm from Training by Rozz. I'm here to talk to you today about life-saving things that you can do, such as infant CPR, child CPR, adult CPR and using a defib. So let's get started.
Let's start by looking at infant CPR.
So first of all, we're going to talk about infant CPR. Infant CPR is something that you would do on a child who is not breathing normally up until the age of 1 year. You can judge the size of a child and decide whether you're going to use infant CPR or child CPR. Some children that are less than 1 year old might be too big for you to be able to do CPR with the 2-finger, 3-finger or 4-finger method that we're going to look at in a minute. If you can't get the pressure that you need from using just your fingers, then you may need to use your hand, and at that point you'll consider that casualty a child. Are you all right? I've got an infant casualty. Can you get an ambulance and a defib and come straight back, please?
Let's break that down, shall we? First of all, you're going to check for danger to yourself, others, and your casualty. You're then going to check response by talking to your casualty and patting them gently on the shoulders. If your casualty is not responding, you're going to consider them unconscious. At this point, you're going to check them for breathing. Gently place 2 fingers on the chin and lift the chin away from the throat. Tilt the head back slowly and gently, trying not to put any pressure on the spinal cord. Now you've opened the airway, place your ear and cheek over the mouth and nose and look down towards the chest. Look to see whether the chest is rising and falling. You can use your arm above the chest to gauge whether the chest is rising and falling. However, do not rest your arm on the chest. If your casualty is not breathing, now is the time to get an ambulance and a defib. The sooner you can get these to arrive, the best chance of survival you're giving to your casualty. As your casualty is an infant, you're going to start off with 5 initial rescue breaths. You're going to lift the chin, just as you did when you were checking for breathing, and tilt the head slightly back. Put your mouth over the mouth and nose of the infant and blow gently into the mouth and nose. Try not to overinflate your infant. These breaths should be the size of a normal breath that an infant would take. You're now going to begin chest compressions. In this case, the casualty is small and I can get a compression of up to 1/3 of the chest using just 2 fingers. If you're struggling to get a compression of up to 1/3 of the chest with your 2 fingers, feel free to use 3 or 4 fingers. At the point where you can no longer do compressions with 4 fingers, begin to treat your casualty as a child and do child CPR, which is very similar to infant CPR. You should do 30 compressions at a rate of 100 to 120 beats per minute. That's the same beat as Staying Alive by the Bee Gees. It's time to give rescue breaths again. Lift the chin and tilt the head, and put 2 rescue breaths into your casualty. Again, you're not going to over-inflate the chest. It's just 2 small breaths, much like an infant would be breathing normally. You're now going to continue 30 compressions and 2 breaths until help arrives, somebody takes over, or your casualty becomes conscious. Let's do it all again and see what you can remember.
Are you all right? I've got an infant casualty. Can you get an ambulance and a defib and come straight back, please?
In summary, first, you're going to check for danger. Once you've checked for danger, you're going to check for response. If your casualty does not respond, you're going to check for breathing. If your casualty is not breathing, you're going to call for help, ask them to call for an ambulance and bring a defib. Give 5 initial rescue breaths, then give 30 chest compressions. You'll then give 2 rescue breaths. You're going to continue with 30 compressions to 2 breaths until help arrives, someone takes over, or your casualty becomes conscious.
Thank you for taking the time to watch these instructional videos. I do hope that you never have to use them. If you have a youth group looking for free first aid information, please feel free to contact me. I also run First Aid at Work qualifications, National Rescue Awards for swimming teachers and coaches, and many more.